All right, non-governmental organization Gift of the Givers Foundation says that they are inundated with by people and patients calling out desperate pleas for oxygen. Gauteng is already exceeding the numbers of infections reported at the peak of the first and second wave. The province accounts for more than 60% of all active cases in the country, and private and public hospitals are under severe strain. Now let's discuss this then further. We're joined via Zoom by Gift of the Givers founder, Dr. Imtiaz Sooliman. Dr. Sooliman, it's always a pleasure to speak to you. Thank you for being with us here on SABC News, sir.
Thank you, Flo. Thank you very much.
Talk to us about just how, desperate this situation is. I mean, I understand that you are inundated, with calls about oxygen tanks. I mean, this also kind of says a lot and paints a picture about the faith that is lost in the public health system and perhaps, government as a whole while we're dealing with this pandemic. Or are you perhaps reading it differently?
Well, it's a combination of both. Let's take the first wave and the second wave. It's not much different in terms of the calls. People want oxygen cylinders, people want oxygen, people want beds, people want to go to hospital, people want some kind of hope for survival. What's different in this wave is that the calls are now coming for oxygen concentrators from general practitioners and physicians. And I find that strange. And I asked them, but why are you guys asking for oxygen concentrators? And they said, look, the problem is there's no beds. The public hospitals and private hospitals are full, and to give the patient a chance for survival, with the hope that some bed becomes available, we're increasing the number of oxygen concentrators we're using at home, and we're doing home care. And the general practitioners and physicians are actually visiting patients at home. But I said, but in the first and second wave, there were so many oxygen concentrators. Yeah. One doctor tells me, we had 140. We need another 500 or 600, and it won't be enough. And that kind of messages we're getting from different doctors from throughout the region in Gauteng. So you have this extra need of doctors having the need for oxygen concentration. And then we said, okay, the problem is Gauteng, there's several problems. One is the number of infection. If you looked at first and second wave, it was spread out throughout the country. In the third wave, the largest number of infections, 67 to 70%, are in Gauteng itself. Yeah. So it means the number of infections in the country, in that province, is the biggest in the whole country, which means more beds are required. But now there's another problem. Charlotte Maxeke Hospital is closed. So we're losing capacity of 300 to 400 patients. At the peak of the second wave, that hospital is holding between 300 and 400 patients and ill ones. So we have that loss. You don't have the space for those patients. And with the extra infections, you're getting more people requiring hospital at the same time. So the physicians are treating patients at home with the hope, that they will survive. But we know that's not ideal, because 5 liters and 10 liters oxygen concentrators are not going to do much when the oxygen requirement becomes higher than that, when people get more ill, when they progress, and they need to go to hospital. And that's where the challenge comes, that more people will die.
Dr. Sooliman, you were watching the situation, the dire situation in India quite closely. I do understand that Gift of the Givers was somewhat involved there. I'm hoping that with that involvement, there were, some lessons learned that perhaps, you picked up that, you can help in terms of stopping that from happening in South Africa. I mean, it's such a huge task for you indeed, but certainly haven't seen, and we saw those visuals coming out of India of what was happening there. And I wonder if there are lessons that you picked up that can be brought here, so that we don't really find ourselves in exactly that situation that we saw.
It's the converse. Yeah. India is asking us, what did we learn from our wave this side? They want that kind of feedback. Yeah. It's simple, Flo. It's very, very simple. You know what? We can say lockdown 5, 3, 2, 1, whatever we want to say. We can say, close this, close that. The reality is that's in our own hands. Yeah. We have to be responsible, because we're the ones that actually carry the virus. It's nobody else. So each person has to take that responsibility. And if we do that, we still got a chance. We are hoping that Western Cape and the other Mpumalanga doesn't go the way Gauteng is going, but it seems to be heading in that direction already. But in the rest of the country, if we just follow the rules of masking, making sure we are responsible for ourselves, for our families, and those around us, wherever we're walking. So the left, the right, behind, and in front. Make sure we're not too close to the people. Make sure there's enough ventilation. Yeah. Make sure you don't spend too much of time in closed places. That's the simple rules. That's what help us. That's from an individual point of view. From a government point of view, we should have learned lessons already from this first and second wave. And one of the big problems is we haven't put enough healthcare workers in hospitals. Healthcare workers get burnt out. They die. They get infected. The number of healthcare workers becomes less, and the burden on existing healthcare workers becomes more, which has happened in the first and the second wave. And we've seen that in Europe and America. We haven't addressed that issue. There was a shortage of medical personnel before COVID-19, and we haven't filled that gap. Yeah. And what we haven't done from the second wave is to make sure we have enough bulk oxygen in many more hospitals, with more oxygen points and more oxygen devices. That's an absolute essential. We all government went on the issue, we're going to vaccinate, and that's going to help us. But we knew for a fact we're not going to vaccinate 45 million people in time of the third wave. Yeah. We had to do two programs, the vaccination as well as parallel preparing the hospitals. Not only have we not prepared the hospitals, one of our main hospitals is even shut in Johannesburg. And for 2 months, and we don't know why.
All right. Dr. Sooliman, thank you very much for your work. Would have loved to continue. Unfortunately, we're out of time at this point, but good luck with all your work. Thanks very much for speaking to us.
Thank you.
All right. That is Gift of the Givers, Dr. Imtiaz Sooliman, and of course talking about some of the desperation really that is happening in our country with calls. They are inundated with calls for oxygen tanks. So just that discussion there.